Millions of Americans turning 65 this year are asking the same question: should I go with a Medicare Advantage plan or stick with traditional Medicare and add a Medigap supplement? And for those already enrolled, 2026 is shaping up to be one of the most important years ever for making this decision. Because the truth is, the rules, costs, and benefits tied to both plan types are changing, and those changes will directly affect your wallet. If you've been hearing phrases like $0 premium or extra benefits, it's easy to assume Medicare Advantage always wins. But once you dig into how these plans actually work, and what's coming in 2026, you'll see that saving money isn't as simple as it sounds. Let's start by setting the record straight. Both Medicare Advantage and Medigap supplement plans exist to help you manage out-of-pocket medical costs that original Medicare doesn't fully cover. But they work in completely different ways. Medicare Advantage, also known as Part C, replaces original Medicare with a private insurance plan that bundles your hospital, medical, and often prescription drug coverage into one. In exchange, you follow that plan's network rules, prior authorizations, and cost-sharing structures. Medigap, on the other hand, doesn't replace original Medicare, it supplements it. You stay on Medicare Parts A and B, and your Medigap plan picks up what Medicare doesn't pay. That typically means no networks, fewer restrictions, and more predictable costs. So which one actually saves you more money? Well, that depends on your health, where you live, and the year we're heading into, because 2026 will be unlike any other year before. To understand what's changing, we first have to look at what's happening inside the Medicare Advantage market. As we covered in previous videos, over 1 million people are expected to lose their existing Advantage plans by the start of 2026. Major insurers, including United Health, Humana, and others, are cutting hundreds of PPO and HMO plan options across the country. Why? Because costs are going up, and government reimbursement rates aren't keeping pace. In 2025, the Inflation Reduction Act's drug provisions kicked in, forcing Medicare Advantage carriers to take on a larger share of prescription drug costs. Combine that with rising hospital prices, increased claim frequency, and tighter medical loss ratio rules, and the margins that kept $0 premium plans alive have started disappearing. And that's the catch. Most people hear $0 premium and think it means zero cost. But in 2026, those $0 plans may come with higher co-pays, new deductibles, referral requirements, or narrower provider networks. In other words, you'll still pay, just in different ways. Now compare that with Medigap. Medigap plans do have monthly premiums, sometimes $120 to $200 per month, depending on your state and plan letter, but they give you near unlimited access to providers nationwide. You don't need referrals, you don't have to worry about networks, and in most cases, your out-of-pocket costs are extremely predictable. So, if you're a relatively healthy senior who doesn't go to the doctor much, a Medicare Advantage plan might seem cheaper. But if you develop a serious condition, those savings can disappear quickly. For example, a single hospital stay, a round of physical therapy, or an MRI under an Advantage plan could cost you thousands in co-pays. Under a Medigap Plan G or Plan N, you'd likely pay your Part B deductible and little to nothing else. If you're finding this information helpful, make sure to subscribe to our channel. We share important Medicare updates and guides every week. Let's break this down with some real 2026 numbers. Based on current CMS projections, the average Medicare Advantage maximum out-of-pocket limit will climb to roughly $8,500 next year. That's the most you could pay in a worst-case scenario, not counting your prescription drugs. In contrast, with Medigap Plan G, the most you'd pay in 2026 for approved medical costs would be the Part B deductible, $257. That's it. So on paper, Medigap seems more predictable. But what about total annual spending? Let's compare the two side by side. Say you have a $0 premium Medicare Advantage plan and you see your doctor several times per year, take a few generic medications, and have one outpatient procedure. Between co-pays, co-insurance, and drug costs, your total annual out-of-pocket could easily hit $1,500 or more, sometimes higher if you have imaging or physical therapy. Now compare that to Medigap Plan G. You might pay around $150 per month in premiums, that's $1,800 for the year, plus your $257 Part B deductible, for a total of about $2,057. If you rarely use care, the Advantage plan could save you about $500. But if you have even one major hospitalization or series of treatments, the Medigap plan wins financially every single time. That's why so many experts say the key question isn't, which one costs less per month? It's, which one gives me more protection when something goes wrong? And that's where many seniors get caught off guard. Now let's talk about one of the biggest myths we hear every year, that you can easily switch from Medicare Advantage to Medigap whenever you want. That's simply not true. In most states, once your first 6-month Medigap open enrollment window closes, you must go through medical underwriting to qualify for a Medigap plan. That means if you develop health conditions later, you could be denied coverage or charged much higher rates. However, here's where 2026 might change the game for some people. With so many Advantage plans exiting the market, affected members will qualify for a special guaranteed issue right. That means they can switch to original Medicare and get a Medigap Plan A, B, C, D, F, or G without medical underwriting. But that window is temporary, typically lasting just 63 days after your plan ends. Miss it, and your options shrink dramatically. For others, staying with Advantage might still make sense, especially for lower-income individuals who qualify for a low-income subsidy or who value extra perks like dental, vision, and gym memberships. But remember, many of those perks are what's known as flex benefits, meaning they can be reduced or removed by the insurer at any time. And with 2026's tighter profit margins, we're already seeing carriers quietly scaling back those benefits. So, how should you decide? Here's a simple framework many advisors use. If you're healthy, have limited income, and are comfortable staying in-network, Medicare Advantage can make sense. Just understand the risk if your health changes. If you value flexibility, nationwide access, and predictable costs, especially for long-term conditions, Medigap will almost always provide better protection. But here's where people make a big mistake. They think they can start with Advantage while they're healthy and switch later if things get worse. The problem is, by the time you realize you need Medigap, your health may prevent you from qualifying. That's why planning early matters. Another factor to watch in 2026 is how Medigap premiums might rise. Inflation in the healthcare sector is affecting every insurer, and as Advantage plan costs rise, many seniors will move to Medigap, increasing demand. That can lead to modest premium increases, especially for plans G and N, which are the most popular. Still, those premiums are small compared to the out-of-pocket exposure of many Advantage plans. And let's clear up another misconception, that Medigap is too expensive. Remember, Medigap premiums are higher because you're paying for certainty. You're buying peace of mind that if something serious happens, your bills are covered. With Advantage, you're betting you'll stay healthy. Both are valid approaches, they just come with different levels of risk. In 2026, more Americans will face the choice under tighter conditions than ever before. Because as insurers withdraw plans and networks shrink, the true cost of zero premium is becoming clearer. The real question isn't whether you can afford a Medigap plan, it's whether you can afford not to have one if your Advantage plan disappears or your out-of-pocket costs suddenly spike. Now, let's touch on something most people overlook: prescription drug coverage. Most Medicare Advantage plans include Part D, but Medigap plans do not. You'll need to buy a separate Part D plan if you go that route. However, with 2026 drug reforms fully in effect, standalone Part D plans are becoming more competitive, and out-of-pocket caps on drugs will provide extra protection. That levels the playing field for Medigap users even more. And if you're already on an Advantage plan, watch your annual notice of change in September closely. If your plan is being discontinued or your benefits are changing, you'll need to take action between October 15th and December 31st to avoid losing coverage. Finally, don't make this decision alone. A licensed agent can compare your local plans, explain your state's guarantee issue rules, and help you time your enrollment properly. Just remember, only agents who represent multiple carriers can show you all your options. If you're finding this information helpful, make sure to subscribe to our channel. We share important Medicare updates and guides every week. So, when it comes to Medicare Advantage versus Medigap in 2026, here's the bottom line. If you want low upfront costs and don't mind managed care rules, Advantage plans can be a reasonable choice. Just be prepared for the potential trade-offs. But if you want stability, nationwide access, and freedom from surprise bills, Medigap plans remain the gold standard. As the healthcare landscape shifts, 2026 will be the year that exposes the real difference between cheap and affordable. Because sometimes, what looks cheaper in the short term ends up costing far more in the long run. If you found this topic helpful, we've covered other related Medicare updates you'll see at the end of this video. Watch those next for deeper insights.